community, work on raising awareness and importance of, I'm sure you do, but what are some of the ways that you try to raise this awareness among people that this is something as basic as it is, it requires attention and kind of urgent attention?
So when we work on a community level through public health, the role of the midwife is actually something really big, because midwives are community-based health workers, right? So this is what we've seen in all of our work, wherever we do midwife-led labor rooms, even through my work at Indus and through Mama Baby Fun, is that midwives, because they come from the community, they can connect with the community on a very different level. So it's not just providing a service and then just being done. They communicate with women and their families and their husbands throughout the pregnancy. They speak to them postnatally. They go into the community and advocate for women to be brought in. One of the things that we do, so through my work at Indus, is that Indus Health Network recently opened the country's first boat clinic, which is in South Punjab. It's on the Indus River. It's a clinic that on a boat. So it's reaching people who've never had access to care. But the issue with that is also that these people they don't have that understanding of when to bring someone in or how important it is. So we've seen women who will come onto the boat who are really, really sick because they've just, had a delivery in the community with some guy who's an untrained birth attendant, have really bad infections, might be on the verge of death, but they'll say that, we've never taken our women out of this community, so we won't take them now. It's just not considered important. So a lot of the work we do is through community health workers, where we literally just speak to families and say that, look, these are the danger signs. This is when it's important to bring a woman in, and think about it in terms of a family unit, that if something happens to this woman, what happens to her children? What happens to your livelihoods? What happens to your family? So there are different approaches. I think we never use we don't use scare tactics, but we use things that work for people, that, what is the role of the woman in this community? And if she's gone or if her child is sick, what happens to you? So those are just some of the things we look at.